Everybody, this is Dr. Sattler here again with your question of the week. Okay, so today's question is, a client is brought to the emergency department in an unresponsive state and a diagnosis of hyperosmolar hyperglycemic syndrome is made. The nurse will immediately prepare to initiate which anticipated prescription? So first of all, let's break down the question. Do we even know what hyperosmolar hyperglycemic syndrome is? And so what it is our individuals with type 2 diabetes mellitus are at risk for hyperosmolar hyperglycemic syndrome. And it's different from our individuals with type 1 who are at risk for DKA or diabetic ketoacidosis. Individuals with type 1 are making little to pretty much no insulin in type 1. And so they're at risk for DKA because they can produce the ketones. Whereas our individuals with type 2 produce a small amount. It's not enough to meet the body's needs, but it's a small amount, so they're not necessarily producing the ketones in type 2. So those individuals will then develop what's called hyperosmolar hyperglycemic syndrome. And so with these individuals, their blood glucose level is going to be very, very high, probably more than 500 or 600, probably more than 600, I believe, with these individuals. So all the signs and symptoms that go along with hyperglycemia, you would see in these individuals. So the polyuria, the polydipsia, the polyphagia, all that with these. So they've come to the emergency department unresponsive, and it's been determined that they have this, okay? So the nurse will immediately prepare to initiate which anticipated prescription. So I told you these individuals, their blood glucose is going to be extremely high. So they're probably not going to need endotracheal intubation. 100 units of NPH insulin. Intravenous infusion of normal saline or intravenous infusion of sodium bicarbonate. So our individuals with a blood glucose that high, we're going to have to do something to get their blood glucose level down quickly. We need to get their blood glucose level down quickly. And so NPH, we know, is not going to do it as quick as we need it. So these individuals are going to need regular insulin, or IV insulin, I should say, and the only one we can do IV is regular. So they're going to need an insulin drip IV of regular insulin. So that 100 units of NPH is not going to get it down quick enough. So that's not going to be our option. Intravenous infusion of normal saline. So remember I said they have all your typical signs of hyperglycemia. So your polyuria, polydipsia, polyphagia. So if you're having polyuria, you're going to be losing a lot of fluids, right? So obviously you're probably going to need some fluid replacement. So that is a good option, but let's just look at number 4, intravenous infusion of sodium bicarbonate. And so typically, a lot of times, acidosis, they might give that to if need be. However, remember with polyuria, you're going to be losing a lot of potassium. And if you mix sodium bicarbonate with insulin, that's going to further decrease your potassium level. And so we don't want to do that. So our answer here is going to be number 3, intravenous infusion of normal saline. So as we stated, the answer was number 3, intravenous infusion of normal saline. So let's read our rationale here. The primary goal of treatment in hyperosmolar hyperglycemic syndrome is to rehydrate the client to restore fluid volume and to correct electrolyte deficiency. Intravenous IV fluid replacement is similar to that administered in diabetic ketoacidosis DKA and begins with IV infusion of normal saline. Regular insulin, not NPH, would be administered. The use of sodium bicarbonate to correct acidosis is avoided because it can precipitate a further drop in serum potassium levels. Intubation and mechanical ventilation are not required to treat HHS. All right, guys, so if you enjoyed this question of the week and you'd like to see more like it, then please consider subscribing to my YouTube channel. Thank you and have a great day.